Welcome to another episode of Get Connected with Eleu. In today's podcast, what we're going to discuss is bronchiolitis and asthma. What do they mean? What do they mean for you and your family and for your children especially? And here to help us and guide us through the medical and non-medical aspects of bronchiolitis and asthma is Dr. Iviano Ossuetta. So Iviano, before we get started, have you ever had bronchiolitis or asthma with your children? Have you gone through this on a personal level, or has it all been medical?
No, it's definitely been personal. I have one child with asthma, and certainly every year for the first 2 years when they were all little, they caught bronchiolitis for sure. Fortunately for us, they didn't end up in hospital, but they suddenly coughed and they wheezed and they spluttered all over the household. So yes, it's been personal for me as well.
So basically, you're going to be talking to us today as a pediatrician and as a parent.
Absolutely, yes.
All right, fantastic. So let's jump right into it. The first thing that would be on anybody's mind is, what is bronchiolitis? What is asthma? And obviously, what's the difference between them?
Okay, so that's our bronchiolitis. First thing is that bronchiolitis is an acute inflammation of the airways and is brought on by infections. Whereas
there's nothing cute about it.
It's not cute, you're right. Whereas asthma is a chronic inflammation that is not necessarily brought up by infection. It may be affected by infection, but typically it's more something that is genetic in composition. You have a predisposition, and there are a few allergens that might predispose you to going on to develop asthma, including having had bronchiolitis, by the way.
Okay, fantastic. So what are the numbers out there? Because is that something that we should worry about as a parent? Look, we've discussed this before, and I'll say it again. My children are older, so my challenges are a little bit different. But 17 years ago and 16 years ago, this would have been very helpful as information for us to know. And so my question to you would be, what's the impact going on globally? Is this something that we as young parents should be worried about, concerned? Are there things that we can avoid? Like, can you give us an idea about the stats?
Sure. So first of all, bronchiolitis, every single year, every winter, somewhere in the region of 150 million children will pick up bronchiolitis, will pick up the infection that causes bronchiolitis. Now, that does not mean that every single one of them will end up in hospital. The vast majority will be looked after at home. They'll cough, they'll sneeze, they'll wheeze, but they're generally quite well. So the numbers are large, and essentially what I'm saying is you might not be able to avoid it, but it may not necessarily be an acute problem that causes you major concern for your child. So that's a big number. Now, the problem with asthma is that asthma is on the rise, so the numbers are not as big. So it's 22 million children that are diagnosed with asthma each year, and that ranges right up to age 19. So when I say children, it includes the adolescents and teenagers. But the problem is that it continues to rise, and the good thing, though, is that there are ways that you might be able to help prevent your child from actually going on to develop asthma, in spite of the fact, as I said earlier on, there are some genetic components to it.
Okay, sure. So let's look at that. So as a young parent, the numbers tell me something. The numbers tell me that I may or may not be able to avoid it, especially if we're living in cold countries, such as in certain aspects of Europe or in Canada, North America. Bronchiolitis is kind of the par for the course. So there would be a high incidence rate, I would assume there. For asthma, does cold, environment and weather, does that affect those numbers? Like, are they leaning towards one side of the globe over the other, or is it all over?
Both of them are all over, actually. So bronchiolitis is worldwide. And unfortunately, so is asthma. So it doesn't really matter where you live. You are at risk of picking up bronchiolitis in the winter season. And similarly, the chances of becoming an asthmatic is probably just as high almost anywhere in the world. There are pockets in some countries and some areas where the incidence is not rising in the same way as it is in other places. But by and large,
Sure.
it's increasing. And we're not sure whether this is something to do with the fact that lifestyles have changed over the decades and maybe centuries. And people have moved from the lower income to the higher income sort of bracket in terms of their lifestyles. And interestingly enough, it's that middle to middle higher income class of people that are actually becoming asthmatic in greater numbers.
That's interesting to know. Well, so I'll explain to you my situation and let me know, are there different types of occurrences or different types of ways with handling whether it's bronchiolitis or asthma? Because when we moved to Canada way back when, before the internet even was a thing, I ended up with asthma. I was 13 years old. I ended up with asthma. I had asthma for a couple of years, and I kind of outgrew it. I didn't even know that was such a thing. And I outgrew it, and I remember exactly what I did. When I moved to Canada, of course, being an immigrant into a new country, coming from a hot country to Canada, I did not understand that, heat and cold were things that I had to deal with. So in the middle of winter, I would, have a shower, get out. I had long hair back then. I had hair back then. And I'd go out, end up in the bus with wet hair, go to school. A few days later, it was something. And I ended up getting asthma. I ended up getting pneumonia as well. I just didn't understand what I was dealing with. Then I started to work out. I started to focus on, even at that young age, I was always, focused on health and activities at whatever level they were at the age of 13. And I kind of outgrew it. Is that something normal, or am I just a superhuman dude? There's only one right answer, by the way.
I would love to say that you're Superman, but actually this is normal. It does happen. So first of all, there are different kinds of asthma. There are different kinds of asthma, and some of them last for longer than others. Look,
you're crushing me here, Evie. You're crushing me.
You did the right thing, though. You took up sports and you became more active and you got healthier. Getting healthier is always going to be helpful, whatever the condition that you have. So that was a smart thing to do. Now, it's very likely that when you moved from one country to another, i.e. you moved to Canada, that there may have been a trigger. Now, I can't tell you exactly what that trigger may have been, but there may have been a trigger that set off your asthma, having had your predisposition. Now, you're fortunate because you were able to do something which helped in a way that seemed to pretty much switch it off. Now, I don't know if you're still asthmatic and maybe you're still using a pump from time to time, maybe a lot less. It might be that you're not using it at all. Now, it's possible that your exercise regime has made you so healthy that it kind of switched off your asthma. That does happen, with or without exercise. But exercise can do either of two things with asthmatics. There are some people who are exercise-induced asthmatics. Now, for them, it's sort of a bind. It doesn't stop them from from exercising. It just means they have to take extra caution, take their pumps before the exercise, sometimes take it during the exercise as well. Whereas with you exercise, you got healthier, you got better, and your asthma seemed to disappear. So not a Superman thing, but a smart thing to have done. But we do see...
No need to throw it back again. I got you the first time.
Just making sure you didn't miss it the first time around.
Oh, I got it. Thank you. So the reality is that I still have a puffer with me. So the reality is that once in a blue moon, I do feel it after all of these years. If I travel, I take one with me just as an emergency. I probably use it 4 times a year. Probably not more than that. But yeah, in terms of triggers, I mean, I did move to Canada and went from an all-boys school to a mixed school. So that was maybe a trigger for my asthma, but I'm not sure if that's a medical diagnosis. So much as an adolescent one.
But you touch on a very important point, Patrick. taking your inhaler with you wherever you go, even if it appears that you almost never have to use it, is a very smart thing to do. Asthma can be severe, and it all depends on the trigger. If you come across a significant trigger, you could have a very severe attack. And that's not the time for you to suddenly realize, oops, I don't have my inhaler with me. So it's smart.
And I don't have the prescription that goes with it, and I don't have this and that.
You might be in a foreign country. You have no idea where the pharmacy is, all sorts of things. So if you're an asthmatic, assume that it's a chronic condition, as I said earlier on. It's not bronchiolitis, it's not an acute thing. It's going to go on for ages and ages. Be smart, carry an inhaler, and just be safe.
Awesome. Well, again, I didn't want to derail us, but this was a situation, and I figured if I went through that, times have not changed enough that we'd be the only family. So I figured this would be a good segue into it. So actually, speaking of which, how do you diagnose bronchiolitis and asthma? And what are the challenges with diagnosis? Because I think there's challenges. Again, if I go back to my time, or even with one of my children who had, infant asthma, again, diagnosis and the challenges around the diagnosis are not as clear cut.
That's true. Now, first thing, bronchiolitis affects adults, older children, and infants. The difference is that the adults and older children rarely present with anything more than a cough, occasional wheeze. The smaller children, the infants who have smaller airways, they're the ones for whom acute bronchiolitis presents with wheeze. And it's the wheeze that causes the confusion between, is this bronchiolitis or is it asthma? Now, on the flip side, with asthma, typically most very young infants are unlikely to have asthma. It's not impossible. Nothing's impossible in medicine, but it's unlikely. So age is a guide. So if you have a 2-month-old who's wheezing, has a runny nose, started off with a cough, and father's coughing, probably it's acute bronchiolitis. You can always check and confirm with a test. That's usually not necessary. If you have a 9-month-old who's wheezing and no history of infection, no fever, no runny nose, you might start to ask yourself, is the child actually an asthmatic, evolving a little bit early on? And that's a possibility. So for that age group, for example, it might become a little bit confusing. One way of finding out is to give treatment. So the treatment for asthma is typically not that useful in a case of bronchiolitis. So the inhalers that you have will usually not produce the effects that you want to have on the child who actually has bronchiolitis. They will get better, resolve their symptoms over time by themselves, except, of course, the ones who are very severe. So if a child is really struggling, they absolutely have to see a physician.
So just to kind of level set here, bronchiolitis can go away on its own with some home remedies.
Absolutely.
Okay. And what would those, well, we'll talk about that later in terms of the home remedies, but what kind of home remedies are we talking about? Is it a good night's rest, or is it, hot chicken soup, or is it all of it?
Hot chicken soup works every time. So good nutrition, ensuring that they're well hydrated, keeping them away from anything that might be noxious. So it might be smoke in the household, cigarette smoke, any other kind of smoke, dust, anything that's going to trigger the airway. Because remember, this is an airway disease. It may have started off with an infection, but at the end of the day, what you have is an airway that's irritated, inflamed, and just does not want any other thing to be added on to the troubles. So if you can avoid all of that, then generally the body will start to repair itself and you get better. You move the virus out of the system, then the inflammation starts to reduce, the child gets better, and then you move on. That's typically what happens.
So on a typical level, what happens on a non-typical level? What happens if they do not get better? Obviously, going to see your, trusting neighborhood pediatrician, that's an important start. But what are the kinds of, remedies at that point? Is it medication? Is there a medication for bronchiolitis, or is it just observance?
So there's no specific medication, if you like. So you treat the symptoms. So if a child gets really bad and is struggling, to breathe at home, is unable to feed, for example, that doesn't want to move around because they're out of breath, they should see their doctor. Now, if they get admitted, then they might require additional things. It might be that they need a drip because they can't feed themselves, they can't drink enough fluids. So they'll get that. They might need oxygen because the oxygen levels when they check in the hospital might be below a certain trigger point, if you like, and requires additional oxygen. And if they're really sick, unfortunately, they might need additional support. So they might end up being on a ventilator, for example. But that's not particularly common at all. So most children, even if they end up in hospital, will probably require some oxygen, maybe a drip. We might find that the doctors will give them some additional different medications, things to try and loosen up secretions and just help clear the airway. They might even try the asthma medications, interestingly enough, because when the airways are that tight and they're in hospital, then it's worth the trial to see if it supports the child. It doesn't always, so some places might and some places wouldn't.
Okay. So before we switch over to the asthma, bronchiolitis, typical time that you would end up having it? Is it 1 week, 1 month?
Usually about a week, maybe 10 days. Severe cases will last longer than that, last a few weeks. And typically what tends to be prolonged is not necessarily the wheeze, but the cough. So they might cough for quite some time afterwards, even though they're no longer wheezing. So they'll be running around pretty healthy, but with a residual cough, if you like.
But, and I obviously take that into account, but what you kind of said earlier for me is the apex of the decision making as to whether or not this is just a cold or a flu is if you hear the wheezing. And if you hear the wheezing in the chest, that should tell you that things might have changed into a different parameter set. Nicely put, simply put, if there's a wheeze, there's a chance it could be bronchiolitis or it could lead to asthma. So at that point, as a young parent, kind of be on your sharpest toes at that point. Am I getting that right?
Absolutely right. Because when you wheeze, you might become breathless. So if you start to hear a wheeze, it's worth definitely getting seen so that there's additional assessment of the child, things that you can't do at home. So they can check the oxygen levels, for example. You typically don't have an oxygen measuring machine at home, an oximeter. So that's worth getting done. If a child is coughing and has a runny nose and you make the assumption sensibly that it's cold, then that's fine. You can keep them at home so long as they're doing all the other things appropriately. But yes, you're absolutely right. You get to wheeze territory, it's definitely worth getting them seen. It still doesn't mean you end up in hospital, but it's worth being seen.
Right. It's at this point, by the way, guys, at this point that we'll let you know that please don't treat this as a diagnosis or consultation. This podcast is for general information purposes only. If you feel the need to go see your doctor, please go and see your doctor. What we're here to do is just educate, inform you, give you very general information, and give you that knowledge base so that you can turn around with that knowledge and make more informed decisions. So you have to, make sure that you take care of your family. Don't rely on this podcast as any kind of diagnosis or consultation. All right. So back to it. Now, that's in terms of diagnosing bronchiolitis. How about diagnosing asthma?
So asthma may present with cough and wheeze. Probably won't present with all the sort of pre-cold symptoms. No fever, no runny nose, no history of somebody else in the household, for example, with a cough, runny nose, sneezing. So there's no history that there's infection around the person necessarily. They just start wheezing. And you may or may not pick up on what the trigger is. They might walk into the kitchen on a day when you're frying some shallots, and the smoke might trigger a cough, and then eventually they start wheezing. That might be the first thing that tells you that actually a child may have asthma. In any case, if the wheeze appears, they need to be seen. Because then your physician can take a detailed history as to how it began, when, what the family history is like. The family history may be a pointer as well. If you already have a strong family history of allergies, wheezing in the family already, then the chances are just a bit higher that this child probably has asthma. And then you can start treatment as required.
Okay, so that's actually very interesting because what is the relation? That's you kind of jumped into it. What is the relationship between bronchiolitis and asthma? Is one a precursor to another? Is there any kind of relationship between them?
There is a relationship, yes. So some children who have bronchiolitis go on to become asthmatic. And it's not an absolute for sure. And there are certain situations that, if you like, predispose to it. So as I said earlier on, your genes matter. So if you have a predisposition to becoming an asthmatic, then the trigger for you may well be that you have a significant bout of bronchiolitis that brings it on, and eventually you end up being asthmatic. So bronchiolitis may go on to produce asthma, but bronchiolitis, by the way, may go on to produce something called a happy wheezer, which I guess is someone in between. They're not asthmatic, they just run around wheezing, cheerful as you like, and they're absolutely fine. And we call them happy wheezers. And they're amazing children who seem to be perfectly well and typically will outgrow that happy wheezing by the time they're sort of 5-6 years of age. But they're an interesting
Anyway,
group.
I have an uncle who's a happy wheezer, but I think that's not that's for other reasons. All right. So I understand that. What are the risk factors for asthma after bronchiolitis? So now we've gotten to the stage here where there's a relationship. What happens after?
So if you've had a very severe bout of bronchiolitis and it's been caused by the rhinovirus, for example, which is the virus that causes a common cold, you may be at higher risk of going on to develop asthma. That can also happen with the typical cause for bronchiolitis, which is the RSV virus. That's the one that comes on literally every single winter. You're going to pick it up. So you can have, with a severe bout, go on to have asthma. Beyond that, it's not entirely clear why it is that bronchiolitis will definitely lead to asthma, and it doesn't. As I said, 150 million children with bronchiolitis, 22 million children up to the age of 19 who are diagnosed with asthma. So clearly, it's not a one-on-one situation. So there are other things. And again, I'll come back to your genetics because actually the genes are very important. But actually for asthma, apart from your genetics, your environment is important. What are you exposed to? Cigarette smoke, other smoke within the house and perhaps outside the house, other allergens, dust mite. We have a lot of carpets in our household these days. This is typical. Almost anywhere you live in the world now, we have carpets. And so you have dust mites in these carpets. You'll have them even in bedding sometimes. So all of these things can be triggers that eventually create that inflammation in the airways that we call asthma. The other thing as well is food allergens. And there are quite a few people who are allergic to different food stuff. If you're out in the summer and you are inhaling a lot of pollen, you might have hay fever, but you may go on to have asthma. So a runny nose, maybe, and sneezing, hay fever, tightness in the chest, wheezing, probably asthma, which may be the type of asthma that only comes on, like yours, when there's a trigger. You don't seem to particularly know your trigger, but you probably have it, which is why it's infrequent. You might be able to identify it if you just try and work out what it is that you get exposed to that makes you wheeze.
Well, it's interesting that you're saying that, because I think Eleu Health was built on the premise that what can be measured can be improved. And what I mean by that is that we need to be not just as, as individuals. You know very well that, especially at certain stages in our lives, we either take care of our parents as well as our children, or our children, or one day it'll only be the children, or it could just be the parents. So that sandwich generation, we're looking at three different types of data sets. We're looking at the data set of our children. We're looking at the data set of our parents, which are complete opposites of each other. And we in the middle are looking at our own data set. And sometimes it's very difficult to unwrap all of the things that are going on, especially with our health and wellness. We take a look at even educational content. Let's discuss that as a data set. A lot of people will get onto social media to escape to, into some form of entertainment. and they don't necessarily want to go and, watch or listen to something that's too heavy that will try to educate or help them in any way, not because they don't want to do it, but because they need the break, and that's very understandable. The problem is that you don't collect data, or you don't know how to collect data. And when you don't know how to collect data and you don't know what to do with it, then you kind of get stuck in a rut. So as Eleu Health, what we focus on is how do you get educated and informed so that you can collect your data. And once you collect your data, what do you do with it? So going back to asthma, bronchiolitis, hay fever, all of these different types of triggers or situational, the situational environment that we live in, what we are not doing is we're not collecting the data in order to understand and to analyze it. Now, an analysis can be something simple, it could be something complicated, or it could be passed on. So I would take that data and I would pass it on to my doctor. And my doctor or my pediatrician would then take a look at that information and be able to provide some sort of diagnosis or consultation or whatever the case is. I think here, as young parents or in the sandwich generation, and I know that this was a very long way of getting to the point, we're not used to collecting data and understanding and making use of that data. So what ends up happening is management and prevention, although important and could maybe lead to a point where you avoid asthma, sometimes, despite our best intentions, we do not properly manage or do not properly prevent this issue. So is there a way, maybe some bite-sized tips that we could inform our viewers and our users so that they can go, right, checklist, 1, 2, 3, go see my doctor, go see the pediatrician? Is there something like that we can do? Anything off of the top of your mind?
Yes,
no
is.
Stress.
Actually, there is. And the thing is that these things already exist. The problem is they're cumbersome. So you have to carry a lot of paper around, or remember to pull out a book and stick something in a booklet. And that's cumbersome. You don't know where it is, whereas you almost always know where your phone is. So if you have access to a facility, let's call it that, where you can quickly just pull something up and input the information, it's easy. So the formats and the questionnaires, they're all out there. And there are different types of them. There are long formats and shorter formats to make it easier for people to collect this sort of information, especially for chronic illness, which is really important. So asthma is a chronic illness. Diabetes is a chronic illness. Hypertension is a chronic illness, not so much something for children, but it is something that you do find in some children. So you can collect this data, you can collate it, and you can take it to your physician. But how easy is it for you to do that? So making it electronic makes a big difference. And this is really the way forward. So you will find that almost invariably now, everyone in the medical field is talking about AI, healthcare, technology, and healthcare, because that is absolutely the way forward. So you're right. These things are actually out there. They're not used as much as they should be. And I think it's just because, as you said, this sandwich generation has got a lot on their minds, and it's difficult for them to manage themselves, the child, the parents, and do all of that, including collecting data, which is absolutely crucial. So if there's a way to collect data easily and share it easily, that's a game changer.
Well, hopefully we have that solution, but that is for a different day. Okay, fantastic. So now, in terms of specific treatments or prevention and management around asthma, what would you say would be the first one? I think obviously we're talking medication, whether it's the inhalers, but maybe you could just give us a bit more color around that.
Sure. So the first thing is avoidance. If you know that you have triggers, avoid them. Whether that's a food allergen, pollen, smoke, cigarette smoke, other forms of smoke, pungent smells, sharp perfumes, whatever it is that you know is your trigger, avoid it. That way you don't start off having an attack, because if you have an attack, then you have to...
I was not going to avoid going to a big school, by the way. I was not going to. I was going to deal with the asthma. Going from an old boys to mixed school, I'm not avoiding.
So no avoiding,
But I get your point.
Version. So first thing is avoidance. The next thing is prevention from the medication point of view and the treatment. So a lot of asthmatics don't necessarily need to have medication for prevention or control, which is a better way to describe it. So they tend to need something to relieve themselves of the asthma attack from time to time. And that's what we call a bronchodilator. So it opens up your airways. And they're typically short-acting. You take a few pumps and you're good. Some people have such significant asthma that they need something to control the inflammation in their airways. Typically, these are steroids. They're usually, again, inhaled steroids in some form, either mixed with something to dilate the airways as well, or just on their own. So the idea is that if your airways are not as inflamed, then even though you technically still have asthma, you're less likely to have an acute attack. That's the thing that you're worried about. Having asthma is having asthma.
That's what you're trying to avoid, the acute attack.
Or the acute severe attack. Okay? So those are the core treatments. And occasionally you have to take something by mouth or by injection if it's really bad and you're in hospital. So that's the spectrum of treatment and prevention.
One of the last things that we'll talk about is the management strategies for at-risk infants. We talked about the avoidance of environmental triggers and that allergens are out there. There are people who live in spots in the world where they cannot move, and the allergens are there, or the environmental factors are there. We could be living next to industrial areas, or we could be living next to a forest that has a lot of the pollens that affect our children. Is there any strategy for those people who are boxed in and who cannot move or who cannot handle a change in scenery? Is there any kind of strategy that you would suggest to them to help them out? We have a saying where it's not avoid or just bash them over the head. There's always a middle ground.
I think the middle ground is awareness. Be aware. Understand that asthma is a condition for which there might be some preventative measures which you might be able to implement. But also understand that asthma is a condition which presents in a certain way that will prompt you to go see a pediatrician or a family physician so you can get the additional help and support that you need. I think the problem comes if you're not aware that your child may have asthma until you have an acute severe attack. And that is something you absolutely don't want to have. Okay? So just understanding that a child who has a cough, for example, that carries on for a really long time, may be an asthmatic who has a cough version or variant of asthma. And that's something that's important to look into. So a cough may seem innocuous, but if it goes on for too long, it needs to be looked at. It may or may not be asthma. Either which way, it's about the awareness and being mindful about your child's environment in terms of how they're presenting to you. So cough, wheeze, breathlessness that you can't explain, these are things you have to bear in mind. So as you say, you might not be able to leave your environment, but you can manage the child so the child can tolerate the environment, and that's really important. But you can't do that unless you've thought about it and you're knowledgeable about it.
Right. Well, we talk about that, but I do know, for example, and I'll just inform our viewers, that you are actually helping us out and writing a blog and an article around this topic to get into that into a little bit more detail. So if anybody wants more information, please go to our website, eleuhealth.com, and take a look at the blog, at the article. I'll also post it in the link below once Dr. Iviano finishes it off, and we can you'll have access to it. Okay, so coming now, as we kind of dock the boat here, coming to the conclusion of this topic from everything that you're saying, if I could summarize that, and please jump in. Bronchiolitis, asthma, they are in high numbers. They are correlated, but they're not 100% correlated. That's why you've got 150 million children who get bronchiolitis annually versus 22 million who have asthma. So the numbers are obviously off kilter. But one can lead to the other in terms of being aware of what are the symptoms between both, in terms of understanding the differences between both. That'll help you to manage and to prevent, wherever you can, certain types of triggers that would lead into one or the other. Have I missed anything, Iviano?
Just to add that understanding that one is acute and generally related to an infection and the other is chronic and typically not necessarily related to infection is important, because that's the guide, additional guide for you to think about whether or not you want to go see your pediatrician or your family physician. Acute infection, cough, cold type of presentation with wheeze, you're thinking most likely this is bronchiolitis. I will go see my pediatrician, but I'm not particularly worried. Cough, wheeze, breathlessness, no history of infection, fever, or any contact with someone who's had an infection, you're thinking, well, maybe this is not just straightforward bronchiolitis and definitely needs to be seen so that we can make a definitive diagnosis. So, but yes, I agree with you.
All right, fantastic. So, Evie, thank you very much for that. That was very informative. Where were you 40 years ago when I had these issues? But I'll be telling you that quite a bit. Don't worry, as we go through all of the steps. So, thank you for that. To all of our viewers and subscribers, if you did enjoy this podcast, please do like and subscribe. And if you have any other content that you would like to know and understand more about from the health and wellness space, please do reach out. Please do let us know. And we'll be able to put that into our roadmap as we are looking to inform and educate people as much as we can around health and wellness topics, whether it's for our children, for our parents, or for ourselves as well. And the most important thing that I can do right now is to say thank you to Iviano, to Dr. Iviano, and to wish you health and wellness. And we'll see you in the next podcast. Take care.
Thank you.